Jeff Slauson here from 19 News Now at the 19 News Digital Desk. The state of Ohio has announced recommendations that were made for the Ohio Department of Mental Health and Addiction Services on basically how to improve the mental health facilities here within the state of Ohio. Now, currently what we are having right now among all of the state facilities, they're at about a 96% capacity. The targeted capacity for beds is a 50-50 split basically between those that are there due to something related to the judicial system and a person who is there based off of some sort of mental health need that is not there as a result of a judicial decision. Think of like a civilian, right? Right now we're at 96% of those that are in the current mental health facilities within the state of Ohio. They're related to the judicial system, related to some sort of a judgment or decision, something like that. That has caused a massive strain on the current conditions within the state. So a study was done, and that study produced 15 recommendations that are being used to try and basically solidify the system, streamline the system, and make it so everybody that needs mental health care within the state can actually get it. And I think that is what is incredibly important about this. In order to effectively be able to break this down for all of you, we wanted to speak with the experts. And of course, that meant we were going to speak with the director, Leanne Cornyn. Spoke with her just a bit ago, breaking down all of this, why it is so important that this is done, is changed, and done effectively. A couple of these recommendations have already been taken into effect. I think you will find this conversation incredibly enlightening for those that are unfamiliar with how this system works and potentially why there are some shortfalls and where we need to see this change. Again, my conversation with the director, Leanne Cornyn. She's the director of the ODMHAS, the Ohio Department of Mental Health and Addiction Services. Again, a very enlightening conversation about a very important topic here in the state of Ohio that is seeing some fairly major changes. To start off generally here, for people that are semi-unfamiliar with how things have been going in your part of the world here and the conditions that you've been seeing, explain where we've been, where we're at right now, and kind of why the need for some of these recommendations.
Oh, the Ohio Department of Mental Health and Addiction Services operates 6 regional psychiatric hospitals, which truly serve as a safety net for individuals in Ohio with very serious mental illness. Right now, our hospitals are at 96% capacity, and 9 out of 10 beds in our hospital system are occupied by individuals with criminal justice involvement. Effectively, that means an Ohioan has to commit a crime to be able to access the kind of care that we provide at our state hospitals, which no one wants, and candidly is not fair to Ohioans.
When you look at those statistics and you see that, to your point, the only way to get that care is really to do something unfortunate here, how did we get to this point, I think is the best way to say it. What led us to that point where it's now at the 96% and these numbers are kind of horrifying to think about in some aspects?
The challenge is really multifaceted, and Ohio isn't alone. This is really a national trend that we are seeing all across the country. I think post-pandemic, we're seeing an increasing number of individuals who may have mental illness or substance use disorder and may need treatment. But this is a trend that has been occurring for some time now, probably for about the last decade. Historically, we had more civil patients, which is just, families, individuals from our communities who were receiving access in our hospitals. But over about the past decade, those numbers have flipped, and now we're seeing fewer civil patients and more individuals coming to us from the criminal justice system.
Leanne, what does this type of experience, this type of data do for those that are working in these facilities, the type of strain potentially that it has on them when they are that filled all the time?
We know that the acuity on our units at our hospitals is increasing. We have individuals with very, very complex behavioral health needs. And historically, we would have a few of those interspersed with other civil patients. But now with the concentration being so high of individuals with very severe and persistent mental illness, some substance use disorder and criminal justice involvement, it certainly creates a more complex healthcare environment in our state psychiatric hospitals. We're very fortunate to have incredibly knowledgeable, competent staff. But it does make it a little bit more difficult for us to recruit the workforce that we need and to retain them in our hospitals.
Let's flip this side of the coin here, because obviously a proactive approach is necessary. That clearly is what you are all doing here. So explain for the folks at home why the decision was made for recommendations and what some of the keys are, I guess the elevator pitch, if you will, about some of these recommendations and how you're hoping they're going to change things.
Well, Governor DeWine has taken this approach throughout his professional career, bringing together the best minds from across the state, from various disciplines to come together and solve really complex, difficult problems. And that's exactly what we did with this work group on competency restoration and diversion. We had an incredibly diverse array of professionals and even individuals with lived experience who convened 8 separate times to help us come up with these 15 recommendations. And those 15 are across a number of different domains. We know we need to do better on preventing mental illness and substance use disorder in our communities so that we're stemming the tide of individuals who need this really high level of care. But there's also things that we can do immediately in our hospitals and within our community and our jails to better serve the individuals coming to us who have mental illness. So these recommendations really chart a path forward, not just for Ohio MOS, but also for our communities on how to better care for these individuals with really complex needs.
Yeah, it does feel like the preventative measures becoming a very important part of this. I'm not going to say that it's new thinking, years new thinking, but it's somewhat progressive as far as, years ago, you wouldn't necessarily see the progressive thoughts on that of we need to do things to prevent this and not to react to it. How important is it to be able to get to the core of the problem potentially before it becomes an issue that would ultimately lead to somebody being in a facility? How can that help in the long run alleviate the stress that we've seen?
Well, Governor Mike DeWine has been a champion of prevention since his days in the Attorney General's office. So it's no surprise, really, that this became one of the recommendations. We know by building up skills to help kids have really the life skills and the coping mechanisms that they need to succeed in life and in the community and as adults. If we can really equip them with those skills, we can prevent their involvement in criminal justice or in illicit substances, or really just helping them graduate from high school and get a good paying job and contribute to society. All of those things that we know are protective factors from becoming criminal justice involved or developing a mental illness. So prevention is absolutely key for us. And it's something that under the governor's leadership, we've really been trying to invest in, but this places an exclamation point on that need.
I just have 2 last questions for you here, both related to the future on this. Let's talk immediate future first. How many of these recommendations have already started to be implemented, and potentially when can we start to see the fruits of that labor? The second part of that is, where do you see us 5 years from now related to this?
So we are already working on a number of these recommendations actively. One of the ones that we are most excited to get underway is our forensic navigator, which is an individual that we're going to hire in 3 of our regional psychiatric hospitals starting very soon. And these are professional social workers, other licensed clinicians who can partner with our sheriffs to help triage and identify individuals in our criminal justice system and in our jails who may need medication management or who really, really do need to come stay with us in one of our state hospitals. So we think that that will be a great addition to this continuum of care to ensure that we are getting our sickest patients, those individuals who really need that high level of care, to it as quickly as possible. And over the long term, what we would really love to see is more average Ohioans, more family members, more civil patients being able to access beds within our state psychiatric hospitals. As I said before, it is a tragedy that an individual has to commit a crime in order to get access to that level of care, and we really want to change that.
What is, sorry, I have a follow-up here. The 90 plus that we're seeing percentage, what is the ideal percentage, if there is one, for capacity?
I think somewhere closer to 50-50, or more civil patients versus forensic patients is really where we would like to be. As I mentioned, even as recently as a decade ago, that's sort of what our patient mix looked like. And it really allowed us to respond to the needs of communities and our criminal justice system simultaneously, without disadvantaging Ohioans. We know that there are so many opportunities for us to increase access to care in the community, but we also know that more beds are probably needed in our state. We are incredibly proud to have recently cut the ribbon on our brand new Central Ohio Behavioral Health Hospital, which replaces our old Twin Valley Behavioral Health here in Columbus, Ohio. Through that project, we were able to add 30 additional beds to our state system. And we are unbelievably grateful to Governor DeWine because in the last capital budget that was signed earlier this year, $10 million was included for us to start work on a Miami Valley Behavioral Health Hospital, which will add more than 200 additional beds to our state system. Now, that's going to take us some time to build a brand new state-of-the-art facility, but we are also trying to ensure that we are adding additional access to our state system.
So we're going to be breaking this down much more in detail today on 19 News at 3 o'clock, starting in just quite a little bit here. But of course, all of this information additionally available on our website at cleveland19.com, an incredibly important topic that very clearly needed some attention. Now it seems that that's happening. The changes are happening. I loved what she said about how those recommendations are already in place. So now we wait and see how successful some of those are, but very clearly a needed change and a needed adjustment for an industry, and a very important industry that is becoming increasingly needed for many, many people. Much more on this and other stories of the day today on 19 News. Of course, I'm Jeff Slauson with 19 News. Have a great day and great night. Much more to come, both on air and online.
19 News, now streaming on Samsung Smart TV. Search for Channel 1035.